Primo Soccorso, anytime you hear Primo Soccorso, the right thing that is supposed to come to your mind, maybe, just as I talk on just now, first help. You understand? First help. Now, who be that first help? First help, now that person, when we say, after accident happen, that first person went past. Primo Soccorso is not a doctor, you understand? Let me say, it could be a doctor, you understand? But it's not only a doctor. So Primo Soccorso is that person when come in that particular spot where we say accident for happen. Immediately after the accident happened, the next person when they say he come. You understand? For example, if you look at this image here, you see we have two people. You understand? You have two people. We have two people here. These two people, you see, this one now obviously this is not the victim, this is the victim, you understand? So that is why here I put I say Primo Soccorso. This one is Primo Soccorso. While the one lying on the ground is the road victim, una vittima della strada, you understand? So this is the road victim and this one is the Primo Soccorso, you understand? That is why here he said soccorre un ferito della strada è obbligo di legge, obbligo morale può salvargli la vita o evitare che subisca ulteriori danni fisici. So, helping a road victim is something that is obliged by law. So it's not something of choice. Do you know that somebody can be arrested, for example, after accident happened for road? You understand? Then they come go check camera. See, say, when this accident happened to this person, somebody passed, and this person refused to do the needful by giving that assistance of Primo Soccorso. That person, will face the penalty that is attached to it. So take note, helping a road victim is not optional. It's something obligatory. Yes, it is obbligo morale, which is a moral obligation. Also, it is, something obliged by law. You understand? And also, here it says, può salvargli la vita. It can save life. You understand? Or evitare che subisca ulteriori danni fisici. And also, if he avoid or prevent this road victim to sustain more damages. You understand? Let's, for example, somebody when we say he get accident for road, you understand? Of which if this person is taken to the hospital in the next 10 minutes, this person feel they are alive. But because of say nobody give this person assistance, this person if he bleed at the end of the day, if he bleed to the other side. So that is why it is obligatory by law, and also it's something that can save lives. So it's not something that you say I feel do, I feel not do. You understand? Now, we are also going to see, for example, if, for example, as a Primo Soccorso, what do you need to do? Because also saving or helping a road victim, you also need to be careful and be mindful of what you do, what you need to do, because it's something that can also lead to problem. It can also lead somebody to problem. You understand? So even as you are helping a road victim, you also need to be careful with what you are going to do. You understand? And how you do that. Yeah. Later, little by little, we go see all these things. Here he said, infine del primo soccorso è quello di assistere ed eventualmente cercare di mantenere in vita il ferito con semplici e immediati interventi, in attesa di più adeguati soccorsi, senza quindi prendere iniziative di specifica competenza medica. As a road user, you need to understand what in this place they talk. What did they tell us? He said the aim of or the purpose of first aid or first help, as I talked on just now, is that of to assist and eventually to make sure, it maintain the life of that road victim with simple intervention, waiting for the arrival of, specialists without, going further to take some special treatment or give some special treatment to this road victim. What are these simple measures that you're supposed to take? You understand? Because somebody moved for road. Okay, they tell you, say, yes, even if say you want to assist this person, but you need to be careful as you assist this person. Not go do overdo or go do what hand or go do over sabi. That is why, if you watch this image here, look at this man here. You see what they do? He carry phone, they make call. So the first thing you need to do as a Primo Soccorso is to carry your phone number and dial 118. By the help of Google location, you feel send them the address of where this thing for happen, or look for look for something around. You understand? Say, see where this thing for happen. Okay, where you there now? Yes, I deal with the patient. You understand? You have already done your part. Then you wait until they come. But not say because of say, don't go later see them one after the other. Waiting you fit do, waiting you not fit do. But always bear in mind, they say you not go fit treat this person. He say, inoltre, bisogna evitare per quanto possibile che il ferito subisca ulteriori danni e che vengano praticati interventi sbagliati o dannosi da parte di altre persone. You hear? So you must make sure say you avoid, all those further treatment. You understand? As much as possible to make sure, or you must make sure say the road victim, sustain further injury, and you must avoid, practicing all those intervention when we say if it go wrong, if it go wrong, you understand? As I said, maybe we want to give an injection, or he tell you say this leg they pain you, just help him shift and go this side. No, all those you don't do all those things. Sorry, so you must make sure say no further damages. So when we say now you can't cause that, you understand? Because if you can't cause further damages, I don't know, it's not a good excuse for that. Then it said occorrerà subito segnalare l'incidente e chiamare I soccorsi qualificati. You understand? So he said it is necessary for you to immediately call 118. Just like if you watch this image here, if you look at very well, because I don't know whether we don't take note of this thing, you will see, say, if you even call ambulance for your house, if you call ambulance for your house, you see those first one will go come, they can only take your temperature. I don't know whether I don't take note of this thing. Those ones can only take your temperature. If, for example, a treatment needs to be done, you understand, for your house, and that is why you see, say, if you they call them, they will they ask you how the situation of things be, how this will be, how this, so that in case they will need to send doctor, they will need to send doctor. All this one way they see for years, so they are not all doctors. You understand? So all of them not be doctors. You understand? But see doctor for inside. This one ain't be doctor, and that is why if you watch her cloth, it's different from the other one. Is it her or he? Let me see. Okay, her. You understand? Her cloth is different from other ones. You understand? These are just assistants. When we say now, then they carry people when they drive that ambulance. So sometimes you see, say, sometimes if ambulance they go, you can't see that other smoker when they follow on. That one I be doctor. This is to let you know, say, even all these ones when they wear these clothes, they're not fit to give, they're not fit treat patient. You understand? So not be you now go talk say you want to go treat patient. Then the next one is Ferita Sanguinante. Somebody when we say in wound and he get blood for body. Now, when somebody they bleed, what do you need to know or do? Here it says, se la vittima presenta una ferita sanguinante, se possibile mettere il ferito in posizione seduta o sdraiata, in attesa che arrivino i soccorsi. You understand? So, here they make us understand, se la vittima presenta una ferita sanguinante, se è possibile mettere il ferito in posizione sdraiata o, in posizione seduta o sdraiata in attesa che arrivino i soccorsi. Which means, if, for example, you see, say, a road victim, he bleed for hand or leg anyway, you understand? Take note. See the write-up. Se possibile, if possible, place this road victim, in a sitting position, or this is posizione sdraiata. You understand? So this is posizione sdraiata. Either you place the person for that lying position, or you place them for sitting position, if possible. Why they talk this if possible? There are some people, I think I've seen a situation like this. Somebody that is just to help one lady to carry and get up. Now the hand when you for carry and it can't be the problem, not be the phone when the lady follow. You understand? He say hand don't come up for position. You understand? So that is why, to me, he say if possible. To me, you understand, personally, if I know, because I don't know the situation, I think go drag him for hand now, the hand go shift, or carry him for waist. I don't know whether, I don't know, because there's some people when we say, so I will just suffer call ambulance, I will suffer wait. Ambulance go come, they go come do the normal thing. After all, even the waste time before ambulance come for you. This is me. But if say you this specialized to be able to know how to take carry on, because as I said, there are some people, if you carry on for hand, that hand, now you will come be the problem. If you carry on for waist, problem. So in order to avoid that, I think I will just call, you understand, and wait for them to come, you understand, so that I know we call the answer question when I not write the answer keep. The second one, he said, coprire o tamponare con materiale sterile o quanto più possibile pulito, facendo pressioni per bloccare il sanguinamento. So, use clean clothes or bandage, or use bandage or clean clothes to take out this wound to make sure say the bleeding is not continue, just as we see them for here. No go carry one cloth when you take clean oil, engine oil, can't use and want to tie them. If it give an infection, any cloth when you will use must be a clean one. Then he said, lavare la ferita con acqua solo se è sporca di terra per evitare una possibile infezione. For example, he said you need to wash them with water, you understand? Only if, for example, you see, say, the teeth did in front of the injury, so that in order to avoid infection, you understand? So that is it. Then, evitare qualsiasi manipolazione della lesione. You must try not to, any of the wound, not try to treat her, you understand? Not go to manipulate the wound, not go to try to, so non manipulator. And also here say non rimuovere eventuali corpi estranei confiscati nella ferita perché la loro estrazione potrebbe peggiorare l'entità dell'emorragia. Prestare molta attenzione e non farli affondere nella ferita durante la fasciatura. That is to say, you must try to make, just as I explained just now, you must try to make sure, say, if something pierces the person wound, you understand, or piercing body, or something bottle break put or wood or one or two things, no go try to remove them, because your process of trying to remove them, it will lead to further damages. It will lead to further wound, further injury. You understand? And moreover, you are not specialized in that field. Even if you do, please, somewhere, please be careful in that, in this very situation. You understand? So the next one, maybe, Corpo Estraneo in un occhio. You understand? For example, an object or something particle, or maybe a piece of bottle, a break, enter, somebody eye. What are you supposed to do? You understand? Here he said, se la vittima presenta un corpo estraneo in un occhio, which is schiaggia di vetro. Which one is schiaggia di vetro? Pieces of glasses. You understand? Boom, all those pieces of glasses. Legno or altro, or maybe of wood, or maybe other pieces of object. He said, bisogna banderglielo senza procedere ad altre manovre. In bracket, non bisogna rimuoverlo. So he said you need to bandage them. You understand? Sorry, let me start from the beginning. So if any of all those objects enter maybe for the eye, maybe piece of glass or wood, or other any other one, you need to bandage the eye without proceeding further for other maneuver. You understand? In bracket, they can't even write and say you no need to remove them. Now, you know what the quiz go do? Quiz go tell you, say, if something fall for somebody eye, maybe piece of glass or those things, say you need to carefully remove them, or you need to softly they massage the eye, all those kind of things. No, remember in bracket, they tell you, say, you no need to remove them. So whether you are careful or you are not careful, no, you no need to remove them. You understand? Yeah, he said, quindi impedire che quindi impedire che la vittima si tocca l'occhio ferito e non massaggiare la palpebra per evitare lesioni più gravi. He said you must try to make sure say you avoid this victim from touching his eyes. You understand? And may they massage the eyelashes. You understand? This one, the palpebra. You understand? So quiz now will tell you, say, if a road victim, something enter your eye, say you need to suffer the, small, they massage the palpebra. You understand? Very fast. Take it fast. You don't need to massage anything, and you don't need to try to remove them. And the reason for that is it's because, let's for example, if a piece of bottle break enter this person eye, do you know that as they try to squeeze out like this, that bottle would cause more damages to the eyeballs. You understand? So that is why they tell you, say, not try to remove them. Attendere l'intervenire specialist. So you need to wait for the arrival of a specialist. Who be this specialist? So Soccorso, you understand? Doctors, when they say they will come with their vehicle. Then here he say, non è vero che bisogna costringerlo o tenere gli occhi aperti. Yes, this is the question I was, trying to remember. So it is not true. Say you need to try to make sure, say you force the person to leave the eye open. You understand? To leave the eye open. No, it is not true. You understand? A bandage to try to make sure, say the person not they touch the eye. You understand? No massage the eye until professionals they come to do the needful. You understand? So these are the questions when we say they attached to these explanations. You understand? So these questions, what will happen? We say we will answer this question. In 5 minutes. Let's try to answer this question. Then, while we proceed for the explanations. Or should we do it like this? Please, let's do it like this, because today's class, to be honest with you, I really don't want to take it further because of so many people were not there around. You understand? So what we are going to do, we are going to take a screenshot of this question and take it as an assignment. You understand? Then, just as it's written here, we'll take them as an assignment. Then, we'll go answer the question when we say we leave yesterday. You understand? Those questions when we say we leave yesterday, we'll go answer them. Then we come answer question. Then it's going to be that for today, because this video, when this at the record, I not even want me to still too long. You understand? So that is it. Please take a screenshot of this question. We'll answer them as assignment. So these ones now the questions of yesterday. To answer these questions, the number one of these questions said, l'idonneità alla guida può essere compromessa se si fa uso di caffè amaro. Cafe Amaro, they compromise eligibility to drive. We remember, say, what we say, they compromise eligibility to drive, now be the use of alcohol, the use of drugs, and, hashish, and, all those kind of things. Now be waiting, they compromise the eligibility to drive. So not bitter coffee, you understand? So the answer is pass. Number two said, l'idonneità alla guida può essere compromessa se si fa uso di hallucinogeni, which is LSD, ecstasy, etc. Yes, it is true. These are some, these are some type of medicine when we say if it compromised eligibility to drive. So the answer is vero. We see them also yesterday during our explanation. So number three said, l'idonneità alla guida può essere compromessa se si fa uso di farmaci antidepressivi. Yes, it is true. If you use, antidepressant drugs, if it compromise your eligibility to drive. So the answer is vero. One number four said, l'idonneità alla guida può essere compromessa se si fa uso di integratori di sali minerali. No, it is not true. Say all those, mineral, supplements. Say the fee, compromise your eligibility to drive. So the answer is falso. One number five said, un'alimentazione pesante ed eccessiva è sconsigliabile per chi deve guidare. Esatto. The answer is vero. All those heavy food, when they eat before you drive, it is not advisable for somebody when we say in one drive, because we see them yesterday. By the time digestion will be taking place, the breaking down of those food, it will, compromise your eligibility to drive. Number six said, l'idonneità alla guida può essere compromessa se si fa uso di integratori alimentari. No, others, those integratori alimentari, they are not, those things where we say if he compromise the eligibility to drive, so the eligibility to drive, so the answer is false. So one number seven, we said, l'alimentazione con cibi di difficile digestione può provocare una diminuzione dell'attenzione e un aumento dei tempi di reazione. Verissimo, because all those heavy food, when they say that they eat before you drive, during digestion, as maybe the food they find it difficult to break down, it will provoke, reduction of attention, you understand, by increasing your reaction time, which is, for example, when digestion would take place, you see, say, you're the dead distracted, you understand? You feel dead dizzy, you feel sleep off. I believe say most of you, the thing don't happen to you sometimes. After you don't, come from work, finish, you don't eat one kind of heavy food. Before you know what thing happen, you say make you relax more, watch television. Now so you hold remote for hand, now there you sleep off. You understand? Why? Because the food when you eat, the breaking down of that food, it affect your body system, so it will make you dizzy. The same thing they happen for driving. That is why it is not advisable to eat heavy food if they prepare to drive. So the answer is vero. I don't know whether anybody get a question to ask. I see your hands up.